here tonight. We have a great panel and looking forward to hearing from them. What we're doing tonight is we're providing facts, resources, tips, and perspective on how residents can live with COVID. I think we started out thinking this was going to be something that was going to be maybe over in a month or two, and we're beginning to recognize that this is something that we're going to need to live with for a while. And so you're going to hear from panelists and experts representing different sectors on how to do that. And this is our first one of a series that we're going to be doing and give you an opportunity to ask questions and have those questions answered, as well as see and get tips on how to live in this new normal. I know some have a reaction to that phrase, but we can maybe talk about that a little bit tonight too, as far as what is normal. I think we're all wondering that a little bit. And we have some great partners. We have partners on the panel tonight from the business community, the medical community, the schools. So we're very excited to have the panel here tonight and have this be first in a series to help us live well during COVID. And so with that, I'd like to turn it over to Carrie Ann Lawson, who will be walking us through the rest of the evening.
So good evening. My name is Carrie Ann Lawson. I'm the Chief Programs Officer for the Health District. Thank you, Tom. That was Tom Backley, our CEO. Before we get started with our panelists and their bios, Lauren and I are going to just go through a few of the ground rules for tonight and explain to you how the Q&A will work. So Lauren, why don't you explain the Q&A?
Sorry about that. Good evening. Thank you, Carrie Ann. I'm Lauren Nakano. I'm the director of the Blue Zones Project, and Carrie and I are going to be moderating tonight. The Q&A is going to be down at the bottom of your screen, and it is the way that you can communicate with us throughout this presentation. We invite you to submit questions as we go, and we are going to we solicited questions through the registration process as people were registering. Thank you for a really good response. We got some great questions. So the first half of our time tonight, we're going to go through those questions and answer as many of those as we can via our panelists. And then the second half of our time, we will field questions from the audience. So please feel free to drop those in at any time, and we have folks in our team who are going to be going through those, and then we will present those to the panelists. I just want a reminder that the session is being recorded tonight, so we will be sharing in a post-event email the link to the video and also including some of the resource links and the presenters' contact info for you after this event is over. The chat is turned off for our attendees, but the Q&A is on. So we encourage you to submit comments and questions that way. And now I think I want to start. Carrie Ann and I are going to introduce our panelists, our four panelists. We are really honored to have them here tonight. They represent a wealth of information across our beach cities. First, I'll introduce Dr. William Kim. He is our Chief Medical Advisor for the Beach Cities Health District here in Redondo Beach and provides medical guidance and oversight to all preventive health programming and community services. Dr. Kim, who currently owns and operates Beach Cities Internal Medicine in Torrance, has more than 30 years of experience as an internist and emergency physician, and spent the majority of his career practicing medicine in the South Bay, including serving as an attending physician in the emergency room of South Bay Hospital, which closed in 1998 to form the Beach Cities Health District. He has also held offices of medical director, paramedic liaison, assistant medical director, emergency chairman, and medical director during his 8 years at the community hospital. And now Carrie Ann will introduce.
It's my privilege to introduce you to Dr. Mo Gelbart, who is the Executive Director of the Thelma McMillen Recovery Center at Torrance Memorial Hospital. Dr. Gelbart is a licensed clinical psychologist, a graduate of the University of Southern California, and has been practicing since 1976. Dr. Gelbart has expertise in alcohol and substance abuse, is certified by the American Psychological Association in the treatment of substance abuse, and was one of the founders of the Thelma McMillen Recovery Center. In addition to his role at the Thelma McMillen Recovery Center, he has been the director of Gelbart and Associates, a multidisciplinary mental health group in the South Bay for 40 years. The practice recently merged with community psychiatry, where Dr. Gelbart serves as director of practice development. He has been a consultant to the California Medical Board Diversion Program and the California State Lawyers Assistance Program, and has wide experience in workplace violence and stress, managed care issues, chronic pain, and work with adolescents and adults in an individual, couple, and group treatment. Thank you for being here tonight, Dr. Gelbart.
And next we have Dr. Anthony Taranto. He is the Executive Director of Student Services for Redondo Beach Unified School District. Dr. Taranto is responsible for all programs and services that focus on the whole child, which prioritizes an expanded role for schools to focus on academic achievement as well as the long-term development and success of all children. Prior to his district role, Anthony has served as the director of the South Bay Adult School and principal of Adams Middle School and Alta Vista Elementary School. And thank you so much for being with us, Dr. Taranto, because we know it's a busy time for you.
And our final panelist tonight is Kelly Stroman, who is the president and CEO of the Manhattan Beach Chamber of Commerce. Kelly drives the robust and dynamic 425 plus business membership and all activities in the business community, as well as advocacy and strategic thinking at the local, regional, state, and national level. Previously, she served on the Chamber Board of Directors while in her role as Executive Director of the Downtown Manhattan Beach Business and Professionals Association for 5.5 years. She also leads the Legislative Action Committee, event planning, marketing initiatives, served on the Homeless Action Committee, and is active in other community organizations like the Manhattan Beach Rotary Club and the South Bay Association of Chambers of Commerce. Thank you, Kelly, for joining us tonight also. So as you can see, we have an excellent panel for you tonight. We've received many questions, as Lauren said, about general information regarding COVID-19, the health guidance and testing. So first, we're going to turn it over to Dr. Kim to give an overview of COVID-19 in the beach cities. Dr. Kim?
So some of the questions came in about who's really at risk for severe disease and death. And as you well know from news, it's mainly the older adults are the most at risk and those with underlying health conditions. So in LA County, about 92% of our deaths are those with underlying health conditions and elderly. Those health conditions are hypertension, diabetes, neurologic conditions, and cardiovascular disease. Some of that too has been spread to our, within the ethnic groups, a higher proportion of deaths in those of color, so as African Americans and Hispanics. The next slide, please. So transmission, it's a respiratory droplet, though there is some concern that there could be aerosolization, but we do know for sure that the virus is spread from person to person by respiratory droplets. That's when someone coughs or sneezes or talks and you're in close proximity. These droplets land in your mouth or nose or on a surface, and then you can touch the surface and touch a mucous membrane such as your eye or mouth, and then contract the disease. This is more likely when you're in close contact with someone. That's within 6 feet, and the contact period is usually more than 15 minutes. Next slide, please. So interesting stats on the state of COVID-19 in LA County. As of yesterday, there were 232,893 reported cases with 5,558 deaths. In our beach cities, we have about 999 as of yesterday, and that's spread out between Redondo at 508, Manhattan Beach at 306, and Hermosa Beach has or had 185 reported cases. Our deaths in the South Bay are also spread a little heavier in Redondo with 9. Manhattan Beach have had 4, and Hermosa 3 deaths. Of interest, our numbers have been reported, and it's the first time in this pandemic that in recent times, that the case count for today is 989 in LA County with 51 deaths. So that's a nice little trend. May we see the next slide, please? So these are the daily hospitalizations, the 3-day average. And you can see a wonderful trend moving down where we had a peak in mid-July, around July 20th, just over 2,200 hospitalizations. And now we're well down, closer to 1,000, which is really a good trend. Next slide, please. This is one of my favorite slides, and thanks to Jacqueline and the staff at Beach Cities Health District. This shows the trend of the cumulative cases per 1,000 individuals in the South Bay. The black line at the top you'll see is LA County. And so below that is Inglewood. And then below that is Hawthorne. And so those are kind of trending along with the cases, the cumulative cases as LA County, similar to LA County. The lines you see further down are ours. And so the El Segundo has seen the less than trends, and then there's Redondo Beach. The gray line is Torrance. The orange line is Manhattan Beach, and then Hermosa is the green line. So that shows a leveling off, which is really significant. And I think we should be proud of it because it means our social distancing and the things we're doing locally are making a difference. We have the next slide, please. This is an interesting by month for our beach cities. You can see Redondo's in blue, Manhattan in red or orange, and then Hermosa is in green. Once again, it shows the trend down. So a big kudos to our cities for doing what we're doing to make this thing better. Next slide, please. I think we know most of this already, but it's never too often that we can remind ourselves that we have to wash our hands frequently to avoid spread, avoid touching your eyes, nose, and mouth with unwashed hands. When you're not feeling well, even a cold or a sniffle, try to stay home and out of public. Practice social distancing, especially by staying home and only going out when you need to. And when you do go out, wear a clean face covering, whether it be a mask or a cloth covering. Next slide, please. So who is eligible to be tested in LA County? Well, anybody with symptoms can be tested. And then all of those who've had close contact in the last 14 days with a known infected individual should be tested. Those who work or live in high-risk congregate settings, such as nursing homes and skilled nursing facilities, homeless shelters, should all be tested. There are a number of limited tests available for our essential workers who are asymptomatic. So those are people with frequent contact with the public. We want to make sure that they're not an asymptomatic carrier. So if at all possible, those individuals should be tested. Now, for those of you that want to be tested, first check with your primary care physician to see if he or she has the capability of doing so, or if they want you to go to a special test center. If they don't, then you can go to covid19.lacounty.gov/testing to find a site close to yourself. Now, next slide, please. There have been some concerns about what's the difference between isolation and quarantine. And a simple way of looking at it is isolation is if you've had the infection or if you have the infection. And then you must isolate for 10 days since your symptoms appeared and 24 hours after your symptoms subside. So that's you're feeling better and no fever without using Tylenol or acetaminophen or ibuprofen for at least 24 hours. The quarantine is different. So that's when you've been in close contact with somebody within 48 hours of their diagnosis, and then you should quarantine yourself for 14 days. So that close contact, once again, means 6 feet for more than 15 minutes, or unprotected direct contact to respiratory secretions, such as a cough or sneeze. People say, well, what if I get tested and I'm negative after like 7 days? Can I go out? And the answer is no. The reason for that is this 14-day quarantine period has been determined by studying a large population of infected individuals. They found that studying 10,000 infected individuals, most of them are symptomatic within 5.1 days. But at day 14, still 106 can become symptomatic at that point. So they thought we would catch most of the people with infection if you quarantine for 14 days. I think that's it for my slides.
Great. Thank you, Dr. Kim. So that was a lot of information. Again, encourage you to submit any questions you have about that. Some of them are the latest breaking numbers. So the other thing I'd just like to let you know is that all of the charts and some of that data is actually on the BCHD website /coronavirus. So please feel free to visit the website if you're looking for more in-depth information. And so now we're going to move to the panel. And it's my privilege to be able to ask Kelly Stroman, our president and CEO of the Manhattan Beach Chamber of Commerce, to address the first set of questions that we received in advance that really are talking about or asking about workplaces and businesses. And so there's about 3 questions that we're going to throw at Kelly, and would really appreciate her response. The first one is, how can I as a resident support local businesses? Because we know that businesses have been doing a lot to adhere to protocols and to get ready for reopening and protecting their employees and their customers. And so how can a resident support local businesses?
First of all, thank you, Lauren, and everybody for having me on the panel. I feel honored to contribute tonight. So how do you support local businesses? It's a great question. And I think what's important to understand is it's more important now than ever to shop local, to spend your dollars local in the South Bay with everybody. All businesses, restaurants, retail, services, they're all working so hard. They're under an enormous amount of stress, not only personally, financially, but to reopen and to adhere to all the protocol. That simply supporting them with your dollars is an amazing support. Supporting them by recognizing and thanking them for following the protocol, when they're wearing the mask, when they're sanitizing, when they're encouraging social distancing with the little dots on the floor. All of that is very, very important, because it's not easy for them either. It's not easy for any of us, but it's not easy for them. And the restaurant workers that are wearing, the face mask covering along with the shield and everything else, and sometimes gloves, especially last weekend out in the 90-degree heat, serving outdoors, that's not easy either. So being kind, being thoughtful, giving extra, kudos to anybody that you're incurring in the business environment, appreciating them, listening to them, and by all means, spending local and trying to, avoid shopping online. A lot of the stores are doing online shopping. Some are doing curbside pickup, certainly, but really trying to spend local with all the different types of business is so important now, and will be for the next possibly 6 to 12 months.
Great, thank you. The next question is related, but what should I expect when I go to a retail store or a restaurant? And Kelly, I'll have you kick it off, and then Dr. Kim, you may want to weigh in on this as well.
Sure. So let's kind of bifurcate those two and deal with them a little separately. When you go into a retail store, there's your small boutique shopping throughout the South Bay, and then there's your larger department stores. Obviously, the malls cannot be open right now, but the kind of the outward facing stores can be. So for instance, if you're in Manhattan Village Mall, the Macy's store is open. It's fully open for business. You enter from the outside entrances. I think there's 2. The mall door is completely closed. The mall is completely shut down. When you go into a larger store like that, you will see usually a roaming person cleaning. Same thing with grocery stores. You'll see a dedicated person cleaning the carts or cleaning the baskets, cleaning a lot of the handles and the surfaces. The dressing rooms in the larger retail stores, there's usually fewer of them open. You can use the dressing rooms, but they usually have, let's say, 1 or 2 open on a floor versus 5, and that is so they can monitor them and they can clean them and keep them clear, of the clothing that you just tried on, and sanitize the room after you've been there. In regards to the smaller boutiques and the little areas in the South Bay, you're going to see, you're going to see the hand sanitizer right as you walk in. You're going to see masks. They're going to be probably a little quicker to approach you and make sure you are wearing your face covering. They're wearing one. You'll see the dots on the floor in all these different places too, encouraging you to spread out. You won't see testers of lotions or candles or, you know, makeup anywhere. You can't do that right now. But you're going to see, you know, and in the retail stores, all they have to do is wear their facial covering. They don't have to wear the protective shield. So moving over to, and, you know, and back to retail, you know, you're going to have your bags in certain cities. They allow your reusable bags, some don't. So just obey and be respectful of whatever the store or the city's guidelines on that. Don't punish them or get angry at them. It's just part of the protocol and part of the rules. When we move over to restaurant side, you're going to see different, you know, probably even more thorough and extreme protective, personal protective equipment. You'll see the servers, anybody interacting with the dining crowd will have a facial covering on, have the full shield over it, often have gloves on. Most restaurants have hand sanitizer on the table, if not on a station in that area. If the tables aren't able to be a full 6 feet apart between, and that's from the center of each table to the center of the next table, you'll see plastic plexi shields in between each one of them, separating and kind of giving you little, you know, corded off squares. You're going to see the QR codes. All the menus now are via QR codes. So get ready if you're not tech savvy. All you have to do is turn on your phone and kind of go, you move it up to the QR code and then go boop, and then pops up a little tab and you open it and there's the menu. And the menu stays on your phone when you're there. You don't have to reload it every single time. Gosh, you'll see temperature checks. That's one of my favorite things, all these fun devices when you walk into a hotel. If you walk into a hotel, they have a temperature check. You know, Shade Hotel in Manhattan Beach has a little iPad machine. You put your face up to it and it takes your outline and boop, your temperature pops up. And then it quickly goes away for privacy reasons. Some of the other places they're on the wall. You have to go up and put your head against the wall for a temperature check. Some actually have kind of the device that they check with you. So you're going to see things like that. A lot of times they'll ask you if you've been in since the beginning of the pandemic. So they know kind of what you're aware of and your comfort level. But we are all in this together. And as the protocols change, they change. And then the stores and the businesses have to adapt to it also, as well as the customers. So we're here to help each other and keep everybody safe.
That's great. Thanks, Kelly. And that you covered a lot, because I think the third question was about how are restaurants and businesses keeping customers and employees safe, which you covered really nicely. If there's anything additional you'd want to add, or if Dr. Kim, if there's anything that you wanted to add to that.
Yeah, sorry, Kelly, go ahead.
No, I was just gonna say one more thing, is, you know, what you won't see behind the scenes at the restaurants particularly is doing the symptom checks when all the employees arrive, and they're going through that. Some of them have apps to do it. Some of them are in person. You know, they're going through, you know, do you feel well? Do you have a cough? Do you have a fever? Taking the temperature and all that too. So, and there's hand sanitizing stations that can't eat in the, you know, other than like a dedicated break room. That's true for all businesses. So what you see as a consumer, there's a lot more safety going on behind the scenes.
Yeah, and I think they're trying really hard, so you want to be respectful, as you already pointed out. From the medical point, you know, when you go shopping, or if you even go to a restaurant, let's say you got to go use the restroom, you'll exit, so you have to touch the door, you're touching things, and then perhaps your phone rings, so you're going to be picking that up. So it's important to try to re-sanitize your hands often when you're shopping, or if you go to the restroom in a restaurant. And then if you do have a hand sanitizer, you might just wipe the surface of your phone as well, because this is an object that you might be setting down in the dressing room. It's just being safe.
Yep. Yeah,
That's great.
Carry your own hand sanitizer everywhere.
Yeah.
So thank you, Kelly and Dr. Kim. Next, we're going to touch on the school-based questions that we heard and hear from Dr. Toronto. On the eve of school starting tomorrow, we appreciate your time tonight. What are some of the obstacles that school districts have needed to overcome to safely open schools?
Thank you for the opportunity to be on the panel tonight. I think actually Kelly did a great job explaining what's happening in the public sector in terms of restaurants and businesses. I don't think it's going to be much different in our schools. And so when you're talking about obstacles, I mean, I think it's taking some of the same principles that are being applied out in the community with students getting comfortable and staff getting comfortable with wearing the masks, washing the hands, and practicing physical distancing. It's getting everyone to understand that it's our responsibility and that we need to model that. And so when you talk about an obstacle, it's just taking those same principles and applying them into the school setting. Because in many ways, school is social in a sense, especially when you have kids who haven't seen each other live and in person in quite some time. And so it's just taking that opportunity to, yes, we want them to connect. We want them to see their friends, see their teachers, and connect with their school campuses. But we have to make sure that we're ensuring everyone's safety, staff and students alike, and we continue practicing what's being asked out in the public. I think another obstacle for all of us will be just getting back into that normal structure and schedule. Our students have been working since March, going into the summer months, where I've heard from a lot of students and families, kids kind of worked at their own pace. They stayed up late, they woke up late, they got their work done, and they submitted it. So right now, as we transition to our first day of school tomorrow, especially through distance learning, students are going to be following their daily schedule by period. They are being asked to report into the period. Attendance is being taken. There are different expectations as we go forward. So hopefully that will assist us when we get to that point, when it is time to return to our campuses somewhere down the line. And then again, I brought this up in a recent conversation with a group of people. It's just we as the adults, we have to continue modeling. And all this starts at home. We talk about everything from the school. Everything starts in the household, no matter what. So we need parents to your continued support, making sure that you're going through the pre-screening at home, you're being honest in your responses, you are educating your child, you're working with them for the masks and physical distancing. I can tell you as a parent, I want to get a little recognition to our Child Development Center. My student has been participating in our Child Development Center since June when we first opened. As you know, it is a child care program, and we in our household have had those conversations. We practice what's being asked of us when we're out in public. And so it was a very simple transition for him going into a classroom of 10 students with physical distancing. And I say physical distancing because I got to tell you, for a 6 going on 7-year-old, he is not coming home with any shortage of stories from his interaction with his peers, which is great because he's getting that social connection. Again, wearing the mask has not been a problem. Obviously, students get a break when they're eating, and if they need a break, they're given the opportunity to do so. And he is reminded to wash his hands frequently. So our CDC team has done a great job of piloting what schools can look like when we get that opportunity to reopen.
So Dr. Toronto, you touched on, schools starting virtually in an online environment tomorrow. How do I motivate my child in this virtual environment?
Yeah, that's a great question that we hear from a lot of families, again, because there's more structure that's being asked of them going into this fall with distance learning. And I think it's a combination of things. It is one, setting down and setting goals for your student. I actually sat down with my 7-year-old on Saturday and we set goals for the year. I asked him to give me 3 or 4 simple goals. We did the same thing last year as he entered kindergarten. And so things that he can work toward. I think you got to create a daily schedule or a routine, making sure you're having a visual reminder up for your student. And then know when to ask for help. That if there are some difficulties in having your students struggle with motivation, reach out to school. We have an amazing team of counselors across the entire district. They're there to help and support students and families. So send them an email and ask them for some sort of support. I know they'll be quick to respond and they want to help. They want to make sure that students are connecting with their school. And I really believe with that motivation piece, it does come down to that connectivity. And so as students are feeling connected with their school and their class and their teachers, they are going to be more motivated to engage in learning.
And then what else can parents and indeed the greater community do to help support our schools right now?
I would say continue just being there for not just your child, but also the children that maybe your neighbors and such, reminding them we're all in this together. I believe Kelly mentioned that as well, that we all are in this together. We need to support one another. At some point, this is going to end and we are going to go back to normalcy, whenever that is. I don't think any one of us has a crystal ball and saying it's going to happen overnight, but just being there to support one another. These are difficult and challenging times. Like Kelly said, and I hate to be stealing her words, but she did an amazing job in just showing that you care, asking for patience, and then also knowing when to ask for help and support.
That's great. Thank you, Dr. Toronto. And just a reminder to the audience, if you have questions, please drop those in the chat because we'd love to answer some at the end of the panel, the first go around. So now we're going to discuss questions related to mental health and hear from Dr. Gelbart. Thank you for joining us, Dr. Gelbart. The first question that we had, somebody submitted, is how do we maintain our mental health when so many things are out of our control? And how do we support our teens and young children and the most vulnerable who are suffering?
First off, thank you for including me on this. This is a great panel and a great thing for the community. And thanks for offering me first with such a simple, focused question as to what should we do about mental health. But anyway, I think it's, we've heard this word a few times tonight, and that's this, we're in this new normal, at least for a while, maybe forever, who knows. Sometimes I think of the, older people I've worked with, and they went through the Depression, and they have lived with those feelings and those experiences sometimes 30, 40, 50 years later, even though depression wasn't there. So we don't know where this new normal will take us. But having said that, so what are some things we can do in order to improve our mental health? I think it begins with, and I don't mean to be too hackneyed about it, or, but communication, and communication with each other and with your family members. And let me break that down a little bit so we understand what some of that is. I think it's really essential to listen with what we call a third ear, meaning listen to what people are saying to you, not just the words, but what's going on inside them, and know how to validate people's feelings. I think that's one of the most essential abilities and skills at every age level. Validate feelings means we listen and we can tell a person in one form or other that we understand what they're going through. I see so many well-meaning people. I've done it myself many times. And I saw it done with my little 4-year-old granddaughter this past weekend. She says, I'm worried about school. And somebody says, oh, don't worry, it'll be okay. Now that's, of course, what we all want to do and make people feel good. But there's a step first, which is to honor and accept and acknowledge, I understand why you're feeling that way. Because when we validate somebody's feelings, it actually builds a bridge. They feel understood, and now they can take the next step as to thinking about what some of the next possible changes in their thinking might be. So communicating, validating feelings, we're in this social isolation, and I'm really happy that I forgot what university, but one of the universities changed social isolation, social distancing to physical distancing. And because, when we're physically distancing, we're not necessarily socially distancing. So learning how to be connected with people in your life and through whatever means you have, we can replace closeness and intimacy with words. So again, communication is essential. I think it's really important in this time to avoid what I call catastrophizing. Catastrophizing, and this will kind of pull into several things, but what we need to do is a number of things that are essential to general mental health. One is control the things we can control, let go of the things we have no control over. Learn how to live in the present, in the here and now. And anxiety comes from when we worry about things that haven't occurred yet. I teach people, catastrophizing means, you kind of begin to make this negative ball start rolling. Well, what if this happens? And what if that happens? And if that happens, what if this happens? And I ask them, stop, take a deep breath, and let's change one letter. Let's go from what if to what is. Because in what is, we can control what we're feeling. We control, not what we're feeling, control what's happening in our life. So try to stay out of the future, avoid what's going to happen bad, and just begin to deal with what is and then controlling the things we can control. I'll run through a few things if you don't mind. Gratitude is really important. Research shows gratitude and expressing gratitude is akin with happiness. And so, I ask people to have a gratitude list every day. It doesn't have to be a huge thing. It could be they're happy that they have food on the table. It could be happy the sun came out today. Whatever it is it's personal, but really, kind of switching from the dark side, if you will, to maybe a brighter side is really important. And as I say that, another part of mental health is learning how to reframe. And it's the proverbial, how do we see the glass half full rather than half empty? And the interesting thing about that is the glass never has to change. Okay, how we feel has to do with how we think. And our thinking determines how we feel. No, whatever one feels is always correct. Never wrong. Somebody can't say to you, I'm scared, and you say, no, you're not. But what we can begin to do is validate, as I said earlier, and then we begin to say, let's take a look at what the things are that scare you. And if they reframe it and begin seeing it differently in a very realistic and honest manner, their feelings begin to change. So you can't change your feelings by design, but you can change your feelings by how you see things. In some way, that's all that any kind of counseling and therapy is helping people perceive certain things in their life somehow differently. But there's several others, we talk, there's eating right, there's exercising, there's taking care of yourself, there's finding special things to do for yourself. And again, they don't have to be big things. They could be, taking a warm bath. Maybe on these hot days, that's not the case. But anyway, they're finding little things to do for yourself. And then as Dr. Toronto said, it's really important to maintain a schedule. They'll probably have people will have these schedules more so, at least school-age children, now that school's on. But I could tell you in the summertime how many kids I've seen who go to sleep, who sleep till 11 or 12, stay up till 2, 3 in the morning playing video games and being on social media and kind of just keep rolling that and eat, eat not healthy foods all along. So anyway, we got to break that routine. And I'm going to repeat what Dr. Toronto said and agree with it fully always. Our kids, now that we're on kids, will do what we do, not what we tell them. So modeling is essential. You can't tell your kids, exercise and eat well and don't drink and then be doing the opposite of all of that, because they'll watch what you're doing and that's what they're going to pay attention to.
Thank you so much.
Mm-hmm.
I think we can all take heed also, so appreciate those tips. The second question gets a little bit deeper, but I'm concerned about my friend and how to identify somebody who's really in trouble, because people are struggling now, and if they come across somebody like that, what do they do?
Great question, thank you. As I think I said earlier, we have probably the highest rates in maybe ever of anxiety, depression, suicidal thoughts, substance abuse, and it's even higher in the 18 to 25 age group, but it's high across all age groups. So not everybody, many people are experiencing lots of this, and most of us will kind of go through this in a sort of healthy, normal fashion without needing any kind of professional help. And so we have to be there for our neighbors and our friends and our family to kind of talk with them and have them for us to talk to. But then what are those signs that people are beyond, a little past that on the continuum? And then what can one do? So it's when people, if you're with people or you hear people close to you and they're beginning to feel hopeless, for example, if they're suffering tremendous, trauma leads to mental health issues. And if people are suffering some of the major traumas of people in their lives dying or getting ill, economic loss and job loss and major changes related to it, those people will have to have certain degrees of resilience to deal with that. And you have to keep an eye on those, when people you care about are experiencing those kinds of things in particular, you have to keep an extra eye. But it's important for me to say, you don't have to experience those things in order to feel depression and anxiety and so on. So you have to listen, you have to hear, and if people are on that other end of the continuum, if they're feeling hopeless, if they're talking about hurting themselves, if they're feeling like things are never going to get better, if you notice that they're increasing alcohol use is tremendously increasing, but if you see people getting a little bit out of control of it, then it's important for you to try to talk to them and be there for them and let them know you care, but also to let them know that there's professional help. We're in an age of telepsychiatry, in an age of telehealth, telemedicine, and most mental health professionals now are practicing on virtual. We have a treatment program at the hospital. It's 100% virtual since March. I'm impressed. We have counselors who are, never touched the computer practically. Not literally, but running Zoom meetings every day. And so anyway, there is help available, I guess is what I'm saying. It's important to know that and to gently bring somebody, help somebody find that.
Yeah. Thank you. And also, we've added, Dr. Gelbart asked us to include some resources at the end. So there'll be some information in case people are in need of that. Just a related question, Dr. Gelbart. How can someone in recovery avoid relapse during the situation?
It's another great question. Well, most importantly, I think, is doing the same things which brought them to recovery, not letting those things go. And again, it may wind up being creative, but if many people in recovery are involved in 12-step meetings. Well, they still have to be involved in 12-step meetings. They may be virtual, but they have to be involved in 12-step meetings if that's what brought them to recovery. The things which help people are again, communicating, being open, being honest, living a healthy life. And I'm repeating some of the things I said earlier, but making sure, it comes down to is being committed to recovery and watching your day-to-day planning and making sure that the planning that you do is in the service of your recovery. And people know, when people relapse, they actually don't relapse when they take their drink. So even in this COVID time, if a person is relapsing, it's not when he takes his drink or her drink. It's when he makes an appointment on Thursday to meet his friend at a restaurant where they know he loves the alcohol on Friday night. So he's beginning to relapse Thursday afternoon when he's making that plan. So you have to make the plans to stay, in recovery on a day at a time basis.
So Kelly brought up this in the beginning a little bit, but I wonder if we could think just a little bit as a whole panel, starting with you, Dr. Gelbart, and then maybe Kelly and Dr. Toronto. What is it like to be an employee in this time? We're asking employees to change their entire work environment and then to deal with the public. So I wonder if you could comment a little bit on employee mental health and maybe ways we can support that.
Thank you. Great question also. I'm going to just talk briefly from one angle, which is the employee who has to be out in the public of one sort or another. I mean, some of us are employees and sitting at home on a computer. It's a different kind of anxiety. But the ones who are out in the public, first off, there is the fears and the anxiety. It's really understanding and it's recognizing what they're going through. I know many people I work with are afraid to go to work, but they have to. They're fearful of getting sick and some what we call our essential workers, and not just on the front line at the hospital. In fact, the hospital people are so great. It's incredible. But really, I'm so impressed with people. I can speak for Torrance Memorial, but I'm sure it's the same little company everywhere else. But, I'm talking about the people who are not trained in that way and all of a sudden have been thrown into this. And, the grocery clerk who has to sit there and greet 200 people every few hours, and they're scared. They're afraid to go to work. And so we have to understand and we have to not judge them for, what they're feeling. We have to be respectful and mindful and accepting of the things that they're going through.
And I agree as well with Dr. Gelbart that, everyone is approaching this from a different lens and perspective. We've all been kind of taken into this new normal, and we're all in a different place in our approach and our understanding of things. And we got to be there for our employees. So without a doubt, I know that I've worked with some counselors over this past summer. They put together a mini trauma-informed training because there's been in March, there was a sudden takeaway of school. And now in many ways, there's a sudden return to school, although being distanced. But you want to be there to acknowledge. Staff need the opportunity to heal and to reconnect with their colleagues, with their school, and then obviously with their students through distance learning, and then eventually in live person instruction down the road. But they're working on trauma-informed training. I watched that presentation the other day at one of the schools on the trauma-informed. I saw today that counselors at one of the school sites did another one on self-care. So again, our team of counselors are really working with their site administrators so they can be there to support all staff, giving them self-care tips, mindfulness tips, and then obviously being a resource to them and letting them know that they can come to them. They're working on creating like these mini type of surveys so that staff can respond. And if they need support, then the counselor can reach out to them and be there for them as well.
I want to chime in too. You know, what's interesting is we have to respect that everybody's comfort level is totally different in this. And as we first started reopening back in May with some of the businesses and in June, many of the businesses, no matter what sector they were in, were having a difficult time and often rehiring their employees or bringing them from maybe, you know, offline work to coming back into the workplace. And we all come from different experiences and we all have different situations at home. Maybe, you know, we're afraid to go back to work because we're healthy, but maybe we have somebody at home that is immune suppressed and we're afraid of passing that along. Or maybe we're just downright afraid or not comfortable. And I think, you know, everybody, employer, employee, consumers, we all have to exercise that compassion now more than ever and really not make assumptions about their behavior or their comfort level and really try to understand that for whatever reason that fear is real, it's real to them. And I know employers, many are having, you know, daily little team meets for the crew that's working, or they have virtual meetings because they really want to assess and talk through it daily. I think part of the problem too is if somebody works at home almost for a long time, then they're kind of afraid to go back, you know, out to the workplace or even to be a consumer and to go out because they've built up a little bit of that comfort zone being away from that too. So you have to kind of exercise that a little bit, but some people are very comfortable and others aren't. And the other thing that I want to say from a business perspective is and this really is true for everybody, there should be no shame if you come down with COVID, if you test positive. There should be absolutely no shame, you know, pointed towards anybody, whether it's you know, yourself, your next door neighbor, a business. It happens. And it's going to continue to happen. And I think the more we all talk about that, you know, and are open about that to the extent that which you can, personally, obviously, if you're an employer, for HIPAA reasons, you can't divulge that information. If an employee tests positive, you can't say who it was. But we should create this a little bit more open environment where there's no shame. I've seen it with just in the residential situation too, like a house or some kids, you know, all test positive, and all of a sudden, you know, that those people are shamed and oh my gosh. And so we got to get rid of that because it's going to happen, and people do make mistakes too, and sometimes people are as careful as they can be and they still come down with COVID. So to the extent that which we can, and remove that shame, report it, tell the person that you were around that you have come down positive, or the person you next to you did, whatever the situation. I think that's so important.
Thank you for that. You know, Dr. Gelbart, you had alluded to this in the sense that we're physically distanced, but that doesn't mean we have to be socially distanced. We see a lot of chatter about the ideas of these social bubble groups and whether or not that's a good idea. And so I wonder if between my two doctors here, we could weigh in on whether that's a physically healthy choice, and if it's not, Dr. Gelbart, what are the other alternatives so we can still be socially connected, even if we're not in these physical social bubbles?
And great questions. And part of what I will address, I will really defer to Dr. Kim in a moment, but you know, in terms of social bubbles, which I know one, unfortunately, that's there because of a cancer situation. So families had to bind together. Somebody's, you know, undergoing, and they really are in a social bubble. So they don't go into this group because they have to take care of the family who's going through this. But most social bubbles that I personally, you know, you're as strong as your weakest link, so to speak. So if you have a social bubble, but your one family over here happens to be a little more, you know, willing to do things that the others are not, and whether they're talking about it or not, that everybody is doing what the most active people are doing, in my opinion. And so, you know, I mean, there are lots of people, Dr. Geronimo, I know, you know, I know people who have formed their own little bubble schools, you know, and they're in their homes with their little preschoolers or older kids, but again, everything is as safe, if you will, as people will agree. And I think, you know, really doing it in a way like the NBA is doing it is pretty darn difficult. So I think you can just, you know, do the best you can with social distance and masks and making, you know, hand washing and all those things that we know. But there's always an element of risk, and everybody has their own personal level to how much risk they want to take. And in line with what was said earlier, we have to honor and respect. We don't have to agree. But we have to honor and respect other people's ways of doing it. We don't have to be around them if we don't like it, but we still can't shame them, as you said. We can't judge them. So, you know, it's whatever people are comfortable with within their own family and themselves. There was a second part to the question, I think, right? Oh, but no, go ahead. I'm sorry.
I think Dr. Gelbart, that was all well said, and I think there are some technology-based ways to also socialize. I know I have not adolescent, but young adult children who get together with their friends, and I forget what day, it was one of these. It might have been around 4th of July, but they had people from England and Canada and all throughout the States. Maybe 20 of these kids were just talking, and they were having a little bit of cheese and crackers and stuff like that. And so that's one way. Also, the social bubble thing is an interesting concept, and it's important. But if you really know your social bubble well, and another social bubble well, as you say, the weakest link is the person that's out there that might be getting into risky environments. But anyway, if you're really sure of your social bubbles, those can interconnect on occasion, as long as it's not a large group. And I think that's safe. There's also testing, and as testing becomes more readily available, if you're going to get out of your social bubble to go see a relative or something, you can get tested and then test upon return.
You know, Dr. Kim would know best again, but I think when they eventually, hopefully soon, get that quick, inexpensive, rapid testing, it'll probably change a lot of what we're talking about. You know, everybody can get tested at home in a few minutes and then go off to a gathering with their bubble.
Yes.
Thank you to you both. So I think all of our panelists have mentioned and talked about this idea that we're in this together, that we really can't do this. We can't succeed if we're all just working in our own environments. And I'll start with Kelly, but I want to open it up to the other panelists. Are there things that are happening or that could happen regionally in collaboration, you know, across cities, that is in support of, you know, us getting across the finish line faster and together?
Good question. Should we talk about Safe in the South Bay?
I was hoping you would.
For anybody watching, this little logo right here, I have on my background, Safe in the South Bay, was created by the Beach Cities Health District, thankfully, and in conjunction, it started off with the 3 chambers of commerce in Manhattan Beach, Hermosa, and Redondo, and has now grown popularity. We've added El Segundo, PV, and Torrance, I believe, is where we're at right now. And you know, that came out of a need to recognize a couple things. First of all, helping employers decipher and weed through the plethora of protocols and information and rules and changes and where to find them, to help them navigate how to deal and help their employees feel comfortable coming back to work and staying safe at work, and then to help the consumer feel safe and be safe when they're out and about. So, you know, facts, knowledge, and confidence and safety. And together we all came up with this wonderful program called Safe in the South Bay. And what that is, if I can indulge for a minute and explain it, is basically if you go onto the Beach Cities Health District website or the Chamber's websites, an employer can take the Safe in the South Bay pledge. And when they click on their type of business, whether it's a restaurant, a retailer, office, or hotel, whatever it is, they will have to go through a certain checklist, most of which they'll have to verify that they have completed, filled out, understand, and really own the particular protocol for their business. They can't just say they're doing it, or they can't just post a screenshot of something. They have to really go through that protocol. And in most cases, there are dozens of points, if not pages of points for the protocol. And I know that personally, when the Manhattan Beach Chamber of Commerce took it, we were rolling out this program. I'm like, wait a minute, I haven't even taken this here at the Chamber. And when I stopped and, and looked at it and started doing it, we had everything, we were doing things, but they weren't always maybe across the finish line on certain things. So it really made us stop and examine all of that for an office and what we need to do. So it helps everybody, educate everybody. And once they take their pledge and they post a picture or they upload a picture of their protocols and gone through everything else, they complete it, up pops a little, they can print out a screen with this little logo in it that says Safe in the South Bay. Beach Cities Health District, Jacqueline and everybody helps monitor to make sure all the proper paperwork and protocols were filled out, because sometimes people are still confused which one they have to follow, and there's reasons for that. So we help them navigate that, and the chambers will help answer the questions and then go hands-on, not hands-on, but call on or Zoom on and help people navigate that. We'll answer those questions, and then when they're finally completed, then we will also deliver, take out, mail, whatever's appropriate, a seal so they can put it up in their window, their main entrance. So you as a consumer know that when you're going into that business and you see that little sticker right there, that business is fully committed. No matter what it is, they're fully committed to making sure their employees are safe, their workplace is safe, they're following all the COVID-19 protocol, and that you as a consumer are welcome there. So I think we're all really proud of that program. We continue to meet and continue to adapt with all the protocols and the changes as they happen, and hoping that it's helping everybody. And I know a lot of people are thankful for it.
Great. Thank you so much, Kelly. That was great. Great overview. And to the other panelists then, from the school perspective, from the mental health or the health service providers, are there other ways that your fields or within your communities that collaboration is really, working in terms of addressing this issue? Dr. Toronto?
Yeah, I can jump in. I mean, obviously, I want to recognize Beach Cities Health District. I mean, we've had this partnership for as long as I've been a part of our BUSD, and that's been well over 10 years. And so I think through that partnership, we've been able to help create some normalcy with our students. We're working hard for our students to have morning exercises and mind-up videos available to them and their students, teachers and their students, so they're accessible. Again, just trying to create this connectivity and normalcy. We're also working with Beach Cities in this partnership to do a passive screening. And we eventually get to this point with Beach Cities and Children's Hospital to hopefully be able to have our people have a testing place to go to. So hopefully I didn't speak prematurely on that, but again, it's that partnership that we have with Beach Cities that allows us to do a lot of things, working with our PTAs, with our ed foundations, just making sure that they're in the loop with everything that's going on, their continued support that we provide all of our schools across our BUSD. And then some of our other partners with South Bay Children's Health Center. We're working closely with them. They're providing tier 2 support to our students who need mental health support. And then Carasols is another community partner of ours that it's a great way for families to find medical care that meet their specific needs in the community. And then South Bay Families Connected. They provide another great resource for family with a great deal of links and resources and articles that families can go on and view and be in the know or knowledgeable of some things that are going on with their children across the district. So those are some that I can think of off the top of my head. Hopefully I didn't leave anybody out, but we do appreciate the support we receive here in Redondo Beach.
Great,
Yeah.
Thank you.
And I'll say, first of all, let me second at least South Bay Families Connected is a great resource and has, I'm always sending people there for information and resource material. Also, Torrance Memorial Hospital is a great resource. I've been there, as I say, many, many years, 40 years, and it's, what I love about and at this time is, we have a treatment program, but half of what we do is community resource. And it is not about just bringing people in, it's about what can we do. And that's what the hospital, is really, that's their vision, their mission, and that's what they're committed to. And I'm proud to be part of that and help put that out there. So we do parent talks, we do talks for kids, we do trainings, we're out in the community all the time and providing, we just had a great 250 people at a free webinar today on trauma. And so we're working very closely with the professional community, and by putting on monthly lecture series where we're drawing more. That 250 people today, I was shocked. Normally we'd draw 50 when it was at our center. So there are advantages to this Zoom environment, I'll call it. We're reaching many more people. So again, I'm the hospital and Thelma McMillen and are working closely with the community in whatever ways we can.
Thank you.
So thank you to the panel. I'm going to let you take a deep breath here for a second. We have about 20 minutes left. I'd like to remind the audience to keep feeding in your questions. We've got some great ones that have been coming in. So you can put your question in the Q&A and we'll work to have the panel address that. Dr. Kim, this next one is for you. Could you explain what the difference is between an antibody test and a PCR test?
Sure. So the PCR test stands for polymerase chain reaction, and that is well known as the nasal swab or an oral swab. So we're actually testing for virus or a viral particle. The antibody tests they can be done in saliva, but the ones that are most reliable are the blood tests, and we're looking for IgG and IgM antibodies. IgM antibodies are antibodies that are produced during an acute infection. They start within hours or a day of an infection. They'll peak and then they'll wane, and the nadir is usually at about 14 to 21 days. Where the IgG antibody starts picking up, that's the immune antibody. And those are the antibodies that we're trying to get vaccines to make. And so these are memory antibodies that when you're subjected to the virus in the future can mount an immune response and kill it. Those are the antibodies that are found in the convalescent plasma that's just been authorized by emergency use to use more frequently.
So Dr. Kim, staying there for a moment, could you provide an update on the state of the race to a vaccine and treatments?
Yeah, it's an amazing subject that's bringing the best of our scientists, not only in America, but around the world, just off the blocks. The amount of research that's gone into this, as well as countries supporting, more than 40 countries have donated more than $81 billion to the development of a vaccine. So the race includes hundreds of vaccines that are in development using platforms that are very novel and new. So right now, at least at the beginning of this month, I think there were 6 vaccines in phase 3 clinical trial. That means the actual testing of multiple populations, or a large population of about 30,000. From that cohort, we hope to get an array of, or a sampling of 3 really good vaccines. So we're seeing some of them are boosting the IgG antibody very well, and others are also boosting T-cell immunity, and both those are important. So we might very well come up with more than one vaccine and try to put them together to make a super vaccine. I think it's, I think all the experts say certainly by the end of the year and early into next year, we're going to have a series of vaccines that are available.
Thank you. A question for Dr. Toronto. Can you give us an overview on the learning plans in place for Redondo Beach Unified School District, and what does distance learning mean?
Yeah, so distance learning, as you know, our governor gave everyone the directive in early July that all schools, especially if you were on the state monitor list, we're going to start in distance learning. And so basically what distance learning means, it's actually combined with a hybrid distance learning, but distance learning will eventually phase into a hybrid or blended. But right now, it means that all of our students are starting off learning from home. So they are going to be following their daily schedule. They'll be checking in with their teachers. I'll give you an example. I'll break it down by elementary. So the elementary school, students will be logging into their iPads or their Chromebooks. They're going to see their classroom teacher. They're going to be able to virtually see their peers, very similar to those of us in the panel, how we can see one another right now. And they are going to get live instruction from their classroom teacher, but it's going to be from the distance, from their home. And that's why earlier we were talking about setting a structure. You also want to make sure that students have their workplace, their learning environment. They want to make sure their materials are right there and in front of them. So there are going to be opportunities for students to have a social emotional learning check-in. I mentioned earlier about morning exercises or brain breaks during the day. And then moving forward to secondary will be similar in the sense that students will follow their daily schedule. So no matter how many periods they have in the day, if they have 0 period through 6th or 7th, then they also are going to be working from home, checking in with their teacher. Attendance will be taken. And so students will see their actual teacher at their respective schools live. And it's a combination of things with synchronous and asynchronous learning, but you are going to see engagement, social emotional learning, as I mentioned before, the student-teacher connection, the peer-to-peer connection, although virtually. And there'll be opportunities during the day later on for tutorial or intervention time. And so distance learning is kind of that. You are learning and working from home at this time, but hopefully we get to that point, it will be a hybrid model and we are able to safely return to our schools in some format.
Dr. Kim, the next question is for you again. Is there anything we should be anticipating for the fall when we think about dealing with both COVID-19 and flu season at the same time?
Yeah, I think in preparation for this season coming up, it's most important for those that are willing to get a flu shot. That's this year more than any year. It's going to be just paramount that we try to vaccinate as many people as possible. The problem is that the influenza, both A and B, and coronavirus, the symptoms are they cross over. Perhaps higher fevers in the corona population, but still some individuals get a very high fever with the flu. What we hope to have is a way of testing to see which it is, because we have good treatments for the flu. There's a couple of medications that are very helpful for those individuals that do get it. So we're looking for a point of service test, an office-based test, preferably a nose swab or a saliva test that can differentiate between influenza A and B and then COVID-19. Now, I've heard from reputable sources that this should be teed up and rolling out in October, but you know, I really don't know. So I really pray that that's available for us clinicians to help ferret out who's got what so we can treat it appropriately. Also, just what we're also doing works for the flu as well as COVID, you know, and that's, we're going to have to continue to wash our hands, face masks and coverings.
And a related question was about where someone can get tested and get the results quickly. So there is a, you know, the lacounty.gov/testing link, but if you have any other insights about that.
Some of the local urgent cares are testing, and they'll have to run it through your insurance plan. There is a platform called the Sophia platform, which offers a test within 30 minutes. The gold standard is the PCR test for acute infection. These other tests, the IgM and IgG antibody test, have a false positive and a false negative rate that some people feel are not acceptable. But still, those platforms I just mentioned and the outfit, the local urgent care, in the beach cities, it's EXER Urgent Care, EXER Urgent Care. I think that's somehow hooked up with Providence, little company. But they do a good job.
Thank you. So, Dr. Kim, you just alluded to this, and this is for all of the panelists. If we're going to be wearing face masks and physically distancing and for the foreseeable future, how would you suggest talking to a friend or a family member who's not following the health guidance? And so, for instance, who does not want to wear the face covering, or I've heard a lot of folks in my generation talk about older parents who are maybe not inclined to stay home and want to resume their normal activities. How would you suggest having these conversations?
Dr. Gelbart, do you want to take a crack at it?
Yeah, you know, I think it's a lot of it has to, I actually wrote a blog on wearing masks. So first off, I'm repeating some of what I said earlier, but one, you know, we have all have a right to choose how we want to live. And we have to respect how someone else wants to, although not wearing a mask is, you know, it's a little different in that it can affect us. So what we have to do is have our own limits, our own boundaries, and in a loving, caring way, if your children or parents, or I say adult children, or whoever it may be, do not want to wear a mask and have and practice social distancing, then you have to be firm with your own, as I say, limits, and say, I love you, I care about you, but we can't get together, you know, and again, you're absolutely right. I've heard, you know, tons of stories about parents and grandparents, and it doesn't matter which one or the other. How come you can't have it? Why can't I hug the kids and play with them? And well, because we don't want to get sick, and you just have to stay sort of strong without shame, without judgment. But that doesn't mean you have to do things you don't really want to do. You know, there's a whole other thing which we don't need to get into, and that's thinking about why do people not want to wear a mask when, you know, it seems so obvious that that's the important thing to do. And again, it's not even political. As I said, I wrote a blog on the psychological reasons for people choosing not to wear a mask. But anyway, rather than go there, that's what I think about this is we just have to take care of ourselves. And, you know, we can talk to people we care about and say, well, why is it you don't want to do that? And people have different reasons. Some, you know, whatever they are, if it's not your reason, thank you for sharing. And you know, we'll talk on the phone.
I think that's well said. I think just pointing out that one, you feel very uncomfortable in the presence without a mask, that and that's easier with somebody you know, a friend or a family member, but somebody in public, they could take offense with that. And so I just distance myself from those individuals and don't even confront them. But for family and friends, I just express exactly what Dr. Gelbart mentioned.
Yeah. The other day, I was driving and I ran to the restroom and I forgot my mask in the car for a minute, you know, public restroom. I thought it was like driving without, it was like as if I was driving without a seatbelt. I was like, oh my God, I got to get back to my car.
Yeah.
And you know, I mean, you wouldn't, you probably wouldn't drive somebody in your car if they refuse to put the seatbelt on. You know, my guess is, so, you know, we have to, again, as I say, take care of ourselves, but not force other people what they have to do.
I want to chime in too. I can speak from the business standpoint. As far as retail goes, at least, and a couple other office situations, if I know in the retail protocol that if an employee cannot wear a facial covering for some reason, but chooses to be at work, that in the retail protocol, they can wear a face shield instead of the actual facial covering, albeit not ideal. It is an option that can be exercised in kind of extreme situations. I don't believe that's true for the restaurant setting or personal care services. You know, you have to have the facial covering along with the face shield. But you know, sometimes even, you know, when you're out and about walking or whatever too, you'll see people wearing a face shield and not a covering. So I think that, you know, that's, again, not ideal, but it's an option in some certain settings too.
Yeah. And Dr. Toronto, in the schools, I mean, you know, you talked about parents modeling and there's rules in the schools. So is there anything about that you would relate to folks around, you know,
I feel like it's our responsibility to model as well. I can tell you that I've had a similar experience where kind of the opposite in some ways from Dr. Gelbart, where there's been times that because I've walked in the morning, I've done my screening coming in, I've checked my temperature and I've recorded it, and I'll come and sit down and it's about an hour later and I realize I have my mask still on because I've just become so accustomed to wearing it especially here in the building. And so again, I think it's all of us just continuing to model with everybody that, yes, when you are on our campuses, you need to wear your mask, you need to practice social distancing. We've created entrance ways and exit ways. We have a great team of M&O people who are cleaning our facilities, but yeah, it's just, you got to get in the habit. And I think once you get in that habit and routine, it just becomes second nature. I even find myself driving home sometimes with my mask still on by myself. So it's become, again, it's like a second skin for me already. It's just there. And I have to remind myself sometimes to take it off, but it's just modeling. And then it is tough having conversations with people who aren't. I personally have had to deal with that with my family. I don't know if I can't see who's participating, but if my family's watching from the East Coast, it was a tough conversation with them about understanding, and they're in their 70s, about they need to protect themselves. They need to wear their masks and they need to wear gloves when they're out in public and doing things because of underlying health conditions. And so it is a sensitive topic, but at the same time, I don't know if it was Dr. Kim or Dr. Gelbart said, well, then I guess I'll just see you virtually or we'll talk on the phone.
So we're almost to the end of our time. I'd like to offer the panelists, maybe we'll go around to each of you for any last thoughts this evening about COVID-19 or anything else we've discussed. Dr. Toronto, I'll start with you. Any last thoughts?
I would say be patient. I mean, obviously, there's a lot of lessons learned as we go through this. Things are still changing every day. Be educated. Stay on top of everything that's happening, not just in your community, but beyond. We are in a bubble in a sense with the South Bay, but look at what's going on in other areas. And then be kind to others. I think it's a lot of stress that everybody's under because things are uncertain and they're evolving and changing almost at the drop of a dime at times. So just remember to smile and be kind to others. I think a smile, even with a mask on, with your eyes, can go a long way for people because we're all at a different point in place. So let's just keep those things in mind when we're interacting with everybody out in the public.
Dr. Gelbart, your last thoughts?
Well, first, again, thank you for doing this. It's a great service to the community. Thank you for inviting me to be with these great panelists. I'll just leave with two thoughts, really. One is, a lot of what we do in our treatment and our 12-step work, the slogans, which are really great, actually work for this. So, one day at a time, and this too shall pass. And then finally, which is not from 12-step, is, you can't stop the waves, but you can learn how to surf.
I like that one.
That's a great segue to Dr. Kim.
Your last thoughts, Dr. Kim?
I just a couple of things. I want to point out that this, for most, it's uncomfortable, but it's not a death sentence. And I have just a little anecdotal story about a gentleman. He's 89. He has every risk factor known. I mean, he's obese. He's a non-insulin dependent diabetic, his age. And he developed COVID and the symptoms on a Friday. He called me Saturday morning. We got him over to Torrance Memorial. We started treatment that afternoon. He got convalescent antibodies early Sunday morning, and we had him home on Thursday.
Wow.
So it's really amazing. And then the other point is, and it's circling around to what Dr. Gelbart said earlier, I love that word gratitude. And so if we can just express gratitude as often as possible, I mean, it kind of gives you a good feeling, but it also helps the person that you're bestowing the gratitude on. So when I go to the grocery store, I want to thank them for being there, and I appreciate what you're doing. I do that to my employees. And I think if we do that more often, this will be a better place and this pandemic will get over quicker.
Kelly, your last thoughts?
I agree with all of my fellow colleagues on the panel. Be kind, be patient, listen openly without, judgment to people. We're all going through this at different phases, and a lot of times it is uncomfortable with the new changes or new adaptations, and whether that's personally or in the workplace, that uncomfortable can be changed and can become, more routine when you kind of own it and you talk about it go to your employer and ask a question. If you're a consumer and you're not comfortable with something that the business is doing, just nicely bring it to their attention, because it might not even be apparent to them. But I do want to echo, when you're out and about, talk to people and tell them how grateful you are that they are there working. Again, last weekend when, this restaurant employee had all the PPE on and he was sweating bullets in extreme heat. And we said, thank you so much. We really appreciate everything you're doing. And he's like, it was like we opened up a floodgate, and he was like, no, thank you for being here. Thank you for coming and eating here and allowing me to serve you. And it was like a love fest. We were just like, oh my gosh, are you kidding? Are you kidding? But I think we just have to all stop, and we're all just listen and be kind. Get your information from credible sources. Don't get caught up in the rumor mill and go down that rabbit hole, and help each other, lift everybody up, each other up, and help all of us navigate this most anomalous of times. Thank you.
I think it's important to emphasize as we end here that there are responsible ways to interact in our community and to patronize our businesses and support and be out and about. And we all have different risk tolerances, and we are safer at home. And so it's important that people continue to really assess when they choose to go out and stay safe at home. Before we end tonight, I want to bring back our CEO, Tom Backley, to talk a little bit about resources and to wrap us up. Tom?
Great. Thank you, everybody. That was a great event, and I learned a lot too. That was excellent. So anybody needing help, we do have our information in referral line. It's 310-374-3426, extension 256. And we're open every day from 8:30 to 5, and there will be somebody there to take your call. And if not, please leave a message and we'll be able to get right back to you. And then also, of course, our website at bchd.org is a great resource as well. And I just want to again thank the panelists. I'd like to thank staff for assisting in putting this together, and I want to thank you for attending as well. And here are some more resources. Again, if you're looking for more information, we have our website here at Beach Cities Health District. We have the Thelma McMillen Recovery Center is listed here as well. The Manhattan Beach Chamber of Commerce, and South Bay Families Connected. And then we have one more. And then this is LA County information. I know sometimes it's hard to find all the information in one place. And so these are some numbers here. The hotline's a good one at 888-700-9995. And that's for businesses and restaurants with questions regarding enforcement and violation issues. And so if you do have a concern about something you're seeing, that's the hotline that you can call. And then if there are outbreaks, this is the number that you call with the Public Health Acute Communicable Disease Control Hotline. That's 888-397-3993. And then there's also another health line there for Los Angeles County. And you can find this information on the bchd.org website as well. And so, again, thank you, everybody. Thank you, panelists. Again, great partners. We're all doing this together as we've been talking about. And thank you for attending. And on behalf of the Board of Directors of the Beach Cities Health District, I want to thank everybody for coming tonight. We do have one board member, Vanessa Poster, was watching. And again, want to thank you, and we'll be providing more updates as they become available, and we'll be providing information about our next Safe in the South Bay series event, which will be in October. And so with that, everybody, stay safe, and we'll be talking to you soon.